Hello friends. आज we have the opportunity to welcome our friend Sabeen Ahmad. Sabeen, I have met you after maybe 20 years. You look exactly the same. Maybe during this interview, you have to give us being ageless, how you've been an ageless person, and share your passion for life and for continuing to move forward. So, welcome, Assalamu alaikum, and thank you for taking the time.
Thank you so much, Farhan. Assalamu alaikum.
Right.
And first of all, I would like to appreciate you that it's such a great effort that you're putting in, reconnecting all of us together after so many years. And really, I have been hearing a few of the interviews that I heard. So it was really inspiring to hear the struggles and the story of each and every one of us. And everyone has a different story to tell. And thank you for the compliment. You made my day. So I'll
No,
be off
honestly,
from the dieting that I
you
had
just have
started
to
in
look back
Ramadan.
in your pictures. I have not said anything that nobody else would admit to. I'll start with our lives. Let's go back from RMC life, right? I remember you among the few pleasant people that I had the opportunity to talk and be friends with. And later on, at the end of RMC, something happened. Everybody disappeared. So where did you disappear? So share with us about your life's turns and moments that we can learn about.
Yes, you're very right. Especially wives of army officers, they did disappear like everyone else. So I had to move from posting to posting, one city to another with my husband. He retired as a major in the army, and life settled down obviously after his retirement. But initially, I did start my training. I did my house job, and I had a passion for gynae. Not before that, when we were doing our gynae nights and duties, I remember we were always looking for someone who would mark the attendance. Koi banda mil jaye jo proxy laga de aur jaan chhut jaye in gynae ki night se. But then when I did my first house job in Peds in Multan, that was in Nishtar. So there, a colleague of mine, he really counseled me well that for a female doctor, it's very necessary to know the basics of gynecology. So Dr. Sabeen, you have to do gynae. So then I came to Islamabad and I did my house job at Polyclinic. And if you remember Dr. Geti Ara, her sister was there, Dr. Gulshan Ara Saeed, with us. She was the registrar then. And we really had a good time with her. And she was such an energetic person that she was my ideal then. So I opted for FCPS gynae training and I did 1 year at Shifa International Hospital. But then some circumstances, they changed because first of all, when I was doing my training, 1 year was completed. My husband's posting came to Kolu, Balochistan. And you know, that phase of life, jab wo husband se bahut mohabbat hoti hai, so I also moved with him. And I left my training, koi nahi, baad mein ho jayegi. But when I came back, then we were posted to Sialkot. Even then we had no training over there. And then at that time, Farhan, my youngest son, Ibrahim, he had started showing some symptoms of autism. And at that time, this was 2008 when he got diagnosed as being autistic. So the whole story turned just upside down. And obviously I had to change my priorities. So after that, I had to work with him, and that's another part I will tell you in detail. So what I used to do just for my own, you know, that sanity to be there, I used to work in the GMC and CMH wherever I went as for the OPDs, and so I just had to stay in touch. And finally, when my husband retired and we settled in Lahore, so I completed my DMRD, Diploma of Radiology. And now I'm working as a sonologist in an ultrasound center. So this is, you know, the brief part.
It's a great segue for us to move forward. And I'm going to dissect a small part of each of this stage of your life, because I think each one of them is really exciting.
No, I would really love to tell the details.
Deeper
and
into
must
it.
Be, yes.
So let me tell you first that the sacrifices that you made for being a housewife of an army officer, you know, it hits home with all of us, especially people who have been raised in army families. I remember
True.
every 3 years, we used to be moved from one place to the other. My dad was in army. And
Right. I remember exactly.
my mom was like this lady who would power up. At the last month, she would pack up everything. We'll have crates everywhere in our house, and we'll be
Exactly.
ready to move. And that was very kind of energetic for her. She loved going and seeing new cities, making new friends. But it is at the same time stressful because, as I've been reading about it, move is a stressful thing. You
Exactly.
all of that
Exactly.
stage with a
True.
smile tells us that you face hardships with an open heart and mind. So that's one thing I want to say. So Nishtar Medical, Nishtar Hospital in Multan, was it an army hospital or was it a government?
No, Farhan, this is a government hospital, and I was lucky enough to get my house job with Dr. Parvez Akbar Khan. You remember the book that we used to study of peds? वो
Yeah,
जिसपे उनके 3 बच्चे बने होते थे.
yeah.
Sir is a legend. मतलब there's so much to learn from him, and he does share his knowledge a lot. And I was really fortunate to have 6 months of training with him in peds. But because as I told you that my colleague that has counseled me, he had counseled me a lot for gynae, so I opted for my second house job in gynae.
Yeah,
But we
so
had a lot of patients over there, like from all the suburbs of Multan, and there was really good practice over there.
I have to tell you that I'm among those people who used to ask our classmates to proxy signature attendance. And I think
Right.
one of the professor found out, and she called me in her office. I think
Right.
most people don't know, and she told me that I know these are fake because I've never seen you, and if you did
Right.
not do 5 deliveries, I'm gonna fail you. You're not
Oh
graduate.
God.
So
That's
I
terrifying.
completely agree with you. Okay, now what did you do in Shifa International Hospital? Did you work
In
as
Shifa
GY?
International, I worked as a medical officer. First PG, the first year of my training was there. But what I have to tell you the difference, because I did my house job from polyclinic, okay, and over there, so much patients in polyclinic, you're just cutting patients and throwing them, okay, a lot of learning. But the thing was, when I came to Shifa International, there were fewer patients, and all the patients were in the beginning supervised. Like we had great opportunity to work with Dr. K.S. Raja, Dr. Yasmin Mahmouda, those of us who work in the gynae department, all of my friends like Dr. Sadia Iftikhar and many others, Dr. Marzia, they all know about these, our teachers. And they are seriously like professional gynecologists. Especially I was really inspired by Dr. Yasmin Mahmouda, by her work, by her attitude towards patients. And there the best thing was, like, we were taught how to like deliver the patient or do all the steps in a professional manner. Like in polyclinic, it was at times that we were not supervised. So even I remember it's really a sharmindagi wali baat hai कि there was this eighth gravida patient, and can you imagine, I put an epi on her and 8 stitches on her because there was no one supervising on me, and it was my first time.
Yeah.
So the thing is that, but in Shifa International, the training is very much structured and you learn a lot. There was the problem at that time when I worked there. This was back in 2003. So at that time, there's the setup, Falahi setup for the lower socioeconomic group.
Yeah.
That was, they had developed it for their medical college and for their trainees. So it was in the beginning. So we had fewer patients, but whatever the learning, it still goes on with me.
Okay, thank you for sharing that. I remember that government hospital setups are sometimes you feel like it's too busy. We don't get chance to actually connect to patients. I understand that when a female is talking to a female, especially a position where other is a physician who could help, a lot of women want to talk about their other struggles. Many of them are malnourished.
True.
Many of them are iron deficient. And gynecologists can also help find out about bone mineral density problems and sometimes
True.
emotional support. Many of them have multiple kids. They're just going through like a machinery, like a factory to produce more and more kids. And that moment,
Exactly.
they can talk to somebody that they idealize. And I think having that opportunity for somebody getting like you, being in that place, could make so many other women's life better. So I think, I hope that our infrastructure is built that way, that we have more personal connections with our physicians, especially women from backgrounds of less resourceful communities. So thank you for
Yes,
sharing.
exactly.
It's an important aspect that we will eventually dig deep into in our series for future. I'm gonna move on to a little bit about Balochistan. That's the part of the country that most of us don't know. How was it life there? I lived in Quetta. I love
Acha.
that. I love that part. My dad was posted for about a year. It was a year and a half, but I love that part. It was open. We had a big house, big yard, and we used to go
Acha.
out.
Right.
So, what was your life in Balochistan?
So actually, we were posted in Kohlu, Balochistan, and this was like Kohlu is on the Punjab border side. Like we
Okay.
used to travel from DG Khan, from Islamabad to DG Khan, and from DG Khan it's 7 hours. Kohlu is 7 hours, and that place at that time, Farhan, it was the political situation was very grave over there. It was that time when Dera Bukti was under the attack, and finally they would be having a lot of clashes between, because there is FC. We have FC over there. It's not army, so
Yeah.
army officers are deployed over there, as you know. So at that time, I think hardly 6 months were of peace when we shifted over there. But after those 6 months, the rest of the 1.5 years was all the time like we had mines blowing up and we had rockets coming on. So it was really like, living with all our duas and our wazifas just for praying for our health. And there was this time I remember that 6 months we had no connection with our family because these Maris, we call them, the locals over there, they had blasted the tower of PTCL. So we had no connection with our parents, with our siblings, and it was a really tough time. So but there was one thing which I enjoyed over there, which I like not exactly enjoyed, but what a realization that there was nothing over there. We just had a what you call tuck shop, which had a few biscuits and a few chips, slanty, TK, and one or two toys for the children. So we knew how to live in minimum resources. So we learned that everything is possible in life.
Yeah. I honestly don't recall this part because I think I might be busy in my own life. In 2003, I was coming to US, and it is uh, it's an experience which sounds pretty scary. But I'm glad that you guys were safe. Um,
Yes,
my
Alhamdulillah.
my question is a little bit about army, being in army. Many physicians, when they're married to army officers, they want to join Army Medical Corps because Army Medical Corps always wants doctors. Did you ever think about joining Army Medical Corps?
Yes, actually, from the beginning, I don't know why, but I don't have any, I hope no offense, that few, that notion that army ke doctor jo hai na like nahi hote. So I never really wanted to join army. But on Major Saab's insistence, I did give the exam half-heartedly without preparation. And that now he always says that if you would have passed that exam, so would have been much better. But I didn't pass that exam. So because I just wanted that I want to do my FCPS training in private and not in the army setup. But anyways, किस्मत में वो भी नहीं लिखा था, लेकिन जो भी लिखा था, that was the best for me, I
It's
believe.
probably best for you and for your family. And let me share with you, you're not alone in flunking that test. I have flunked that test too. My dad
So
came
good
up
to
to
know. I
us.
feel better.
Yeah, my dad came back to us. Sakib was my study mate, my close friend, and we
Achha.
used to study together. And it was
Right.
right after our medical school, and I was like just having fun that okay, I'm done with
I
study.
remember exactly.
Yeah.
That was the
And
one I
he
gave.
came back
Exactly.
and he said, "Oh, in 3 days, this is an exam coming up for army, and you guys have to take
Achha.
it." Okay.
Right.
I was like, okay, I didn't really take it seriously. And Sakit was much mature, and he knew that
Right.
it's a lifetime opportunity. He knew I'm fooling around,
Right.
but he was serious. He passed, I failed. My dad came up and he said, okay, so, I tried my best, you confess, so don't feel bad about it. Now, let's move on to our topic a little bit about your uh, from gynae, then you became now an ultrasonographer, radiologist, a sonologist, and you work in Lahore. When did that change happen?
That change, well, not, not a planned change, but it was like this, that when my husband retired and we were settled in Lahore. And basically, why Lahore? Because, people from Islamabad who have lived their whole childhood in Islamabad, they don't like Lahore, seriously. And but the thing was that when we were in Karachi, I was looking for a mainstream school which was good enough for Ibrahim, because over there in Karachi, he had gone to city school, which claimed, the city school, they claimed that they do have inclusive education, but it wasn't a good experience. So I looked for a school which I found that they have a lot of awareness and they take care of the kids as far as bullying is concerned and the academics and everything. So because of that, we shifted to Lahore, and when we settled here, after I think 1 month, even my 15 days, even my things were not unpacked and everything, I got an offer from University of Lahore for demonstratorship. So I joined there, and I think 6-7 months later, they told that DMRD is starting. So it's a private university. Everyone said that it's बहुत easy है, घर की बात है, कोई मसला नहीं है, सब कुछ हो जाएगा. So I joined शुगल में. But the thing was कि it wasn't like that. There was the first two badges who जो इस तरह से निकल गए, but later on they streamlined the things, and हमारी दफा वो कहते हैं ना कि साड़ी वारी आई थे
Oh,
कुड़ी
yeah.
दा प्यो आ गया, बस वो हमारे साथ वो हुआ. So anyways, this is how I came into radiology, with no spark for it or anything. But when I completed my degree in 2017, I had this passion for ultrasound, and especially that gynae passion that I had. So thoda sa I got that flavor over here as well. So now I feel happy.
I think that life has gone in a circle. We skipped a part
Exactly.
of, your taking care of your children with special needs, and I'm gonna go deeper into it. That's why I kind of skipped that. It started like you wanted to do GYN, you had to go through certain roadblocks, or maybe God had a bigger job for you, right? Family comes first.
True.
And you had to take care of them because God has gifted you with a compassionate, loving nature, and we can't overcome what God has written for us in our faith. And you had to go through that, and eventually you came back to GYN, but in a role of a sonologist or a radiologist. So I think with that note, I'm going to ask you: are you an assistant professor at University of Lahore? And that is pretty remarkable that you actually have an academic role too.
Worked here for 4 years, and after my DMRD for another 2 years. So I got promoted recently in last October, and I'm now enrolled for the clinical job. So I teach students, I do the patients, I teach them ultrasound. So teaching was one of my passions, like that bachpan ka shauk. So I got a flavor of everything that I had wished for.
Yeah, it's a beautiful thing that, how God takes care of our prayers and wishes, but in a way that the time frame is always of His choice. Our Creator has a way of giving us things. Sometimes we are too eager, and I've done my share of being stupid or eager and trying to jump onto things.
Exactly.
I'm looking at Gilani Ultrasound Center's Facebook page, and I'm finding
this is Gilani Ultrasound Center.
Yeah, that's very. So they do a lot of teaching. They have this on their website, musculoskeletal trainings and other. So is that?
Yes, actually, our dean, Professor Syed Amr Gilani, he is the pioneer of musculoskeletal ultrasound. So he offers training for various courses, the basic course, as well as there's another course named as ARDMS. So he also offers that. We are only for the basic. Obviously, abhi to utna level nahi hai. I've been working in the ultrasound for last 2 years. So, but in medicine, there's always so much to learn. You never can say that it's stopped and you're perfect. So it's still going
That's
on, but they're doing a remarkable job as far as teaching is concerned. We have really good teachers, and in the beginning, sir also used to take the classes himself, but now all those people who have been trained directly under him, they are training now.
Musculoskeletal ultrasound has, for the last about 15 years, has been an important tool for rheumatologists to use in their clinics. Most of the time when the patient comes to me with joint pain, knee pain, or shoulder and everything, I have a machine. I'm not as good as radiologists, but I can actually pick if they have joint effusion and stuff. So I'm happy to see that that is being offered at your center. That's great. Okay, well, I want to ask you now, I know that you are passionate about bringing awareness about autism in Pakistan. I have to tell you my ignorance, admit my ignorance. I did not know about autism until I came to America. What autism is when I was even a medical student. So tell us a little bit about what you, as a mother, as a physician, and what do you see happening for future?
Right. Like Farhan, you're very right. Even I remember that in our books, there was just, I think, a single or 2 sentence topic of autism, and we had no idea what it is. And I still remember that when Ibrahim was 1.5 years, so my Mamu and Mumani, they said, "Ke lagta hai kaise autism hai," and I was like, "Pata nahi kya ye keh rahe hain." Anyways, the thing is, it's a very growing problem. Like when I came. I think this was 7 years back when I came to Lahore, and I introduced myself to my colleagues. And when, there were always some close ones, and I told them, they said, "What is this? We don't know anything about it." And when I told them the details, after that, every 1 month, 2 months, I used to get a call from a colleague, from any old previous, or army officer bhabhi, and they were telling me, my second cousins, their children being diagnosed with autism. So the thing is that, first of all, the first thing that we have to understand is that, usually what happens is what I face as a counselor, the problems that I face with mothers, that mothers don't want a label for their child. I agree that labeling your child is a very difficult situation, and obviously it takes time, and it's not so that I haven't passed through all these phases. The first phase is always denial, then depression, and then you go for the therapies. Obviously it's a natural thing. Why me? Why not anyone else? Mere saath ye hona tha. और भी इतने मसाइल हैं जिंदगी में, बचपन में भी ये हुआ था. Obviously everyone goes through all these phases. But what I tell my clients and my friends or colleagues, whoever has to pass through this phase, okay, please forget about the label. We don't say that your child is autistic or ADHD or anything. Just consider that your child is different from a normal child. If you feel this, then just go for the therapy. And I always guide them for the therapies free of cost, and I always do parental counseling free of cost. मतलब ऐसी बात नहीं कि मैं show मार रही हूँ. The thing is that I want to spread the word, what I have learned from Karachi, from the institute. It's a really great institute, Center for Autism Karachi, where Ms. Ruhi Maroof. So the thing is that the parents, they should be concerned, they should be alarmed if a child by 2 years of age does not speak or doesn't have age-appropriate social responses like eye contact, social smile, building rapport, or he engrosses too much, in himself. एक ही toy लेके बहुत देर खेल रहे हैं, या computer पे, या कोई भी screen time, कोई भी ऐसी चीज. And the problem, Farhan, is that there's a very thin line between behavior issues and between autism. That thin line has to be separated from a proper functional assessment. I have a lot to say about it. So if you have any question, you can ask in between.
Sure. So the earliest age where autism can be observed as parents is 2 years?
No, even earlier than that. if you have better testing kits and if parents are educated, like I have a client who's coming to me and they got him diagnosed at, I think, one year and 4 months like this, but they were in the United States.
Okay.
And because the thing is, in Pakistan, we have a lot of taboos, as you all know. Even I remember, you see, me even being a doctor, everyone was like, कवे का झूठा खिला दो, ये वाली दुआ पढ़ा दो. Not that I am also religious, I'm काफी religious. But the thing is that जो इलाज है वो तो करना जरूरी है ना.
Sure.
And I still remember कि I have done all these things. कवे का झूठा भी खिलाया, ये सब कुछ भी किया. Actually, थोड़ा सा the unfortunate part with me was that my father had delayed speech. My grandmother told me he spoke at 4 years, and 2 of my brothers, they had delayed speech. They also spoke at 4 years. But that delayed speech, which that had no other behavior issues, no tantrums, nothing else. So we can demarcate this. But the thing is that everyone in Pakistan, even you would be surprised that some of the people, my close relatives, what they tell me, because now, alhamdulillah, Ibrahim's symptoms have reversed. And there are a few, obviously it's a lifelong disorder. There are a few problems of rigidity of thoughts and, set patterns. But the thing is that there are relatives who say, कि देखा हमने कहा था ना कि सब कुछ ठीक हो जाएगा, सब कुछ ठीक तो हो गया. We are living with the child and ask me कि सब कुछ कैसे ठीक हुआ है. So the diagnosis, as you asked me, that it can be as early as 1 year, because the stage at which the child starts babbling. The thing is that if the parents are so, vigilant, that they observe these things, because most of the times you're so busy in all other routines that you can't very quickly pick up these things. Even when Ibrahim was 2 years, then I thought retrospectively, this happened, and I should have looked at that time.
So let me summarize. I think you elaborated in a very nice way. Early recognition as parents is important. And the signs and symptoms can start as early as 1.5-year-old kid. And they can start as problems with speech. But that is a common issue with a lot of Asian people or people who are raised bilingual. And I'll share my personal experience about that. The second feature that you suggested is their social interactions. They tend to be more isolated and by themselves. Right. And then I think what I'm understanding by how you're explaining is that they don't like interruptions. They try to be alone and concentrated on what they want to do. Is that true? Like if a kid is playing in a corner and you go and ask them or take away that toy, they will have a tantrum. That behavior problem is representative of that?
Yes, exactly. They don't like interruptions and they have their own routines. So they don't want that routine to be broken up. So there are many things, like even I remember that my mentor, Ms. Ruhi Maroof, she used to go to JPMC on every weekend. So there were people coming from villages and suburbs. So I asked Ruhi, how do you diagnose someone who's not even literate? How do they come to know that there's something wrong? So they say that, she told me that, Sabeen, they come there, the mothers, and they say कि 4 साल का हो गया बच्चा, toilet trained नहीं है और बोलता नहीं है. So obviously this is a grave concern for them, because there are those people who get them toilet trained in the purpurium. So there are many things which can be correlated, and we can get, especially now that there's so much on the internet, and but still it's a better idea to get the proper functional assessment done.